If I could say anything about hospice to others who might need hospice care for themselves or a family member, it's that I only wish I had called sooner.
I think hospice is one of those venues that allows us to provide an alternative level of care for patients that don't need the acute care setting.
Many people don't know that much about hospice and what it can really do for families and for people with cancer or many other progressive illnesses. Hospice is really a place where you're adding quality to life.
We didn't realize that hospice can help people for 6 months or longer if needed when they're in a terminal situation. And that really made such a difference.
I've come to know so much more about hospice from what I knew in the early stages back in the 1970s, and I've come to know that it is a full-service organization and one that continues that sense of compassion that is its origins and roots. I'm very, very grateful for what it's brought into my family and my life. I do have one regret, and that is that we waited perhaps a little bit too long when we could have been having that comfort a little bit sooner.
The advantage to working with hospice is that you have a family approach which is centered on their needs as a resident is going through the experience at end of life as well.
I've done about 3 decades of research on hospice, and a couple of the key things we know about hospice is first, patients and families flourish when they are able to get hospice services early. In fact, in a large study of people who were dying and their families who survived them, those patients who got to hospice early in the progression of their disease, their family did much better later.
The decision to ask hospice to come in and intervene in a family situation like that is a difficult one, because in some ways you view it as a surrender. You view it as a giving up of the preservation of this life that you care so much about. In fact, it's the opposite. It's providing dignity to that individual.
It starts when you enter the building and you see an individual that's very giving and very caring, and that attitude permeates the entire staff of Hudson Valley Hospice. It's very rewarding to understand that people are so sensitive to the needs of patients at this particular point in their care.
There's a point in the care of a patient where being at home is better than being in the hospital. So having a resource that allows the patient to stay in the comfort of their home with their family surrounding them, that's what hospice provides.
The specialty that hospice brings not only helps with the emotional aspects of death, but it also deals with the interaction and relationships of the family members. It could also deal with pain management.
When I first meet a patient, knowing that they have limited time left, I know I have to make each visit count. Some patients they have a lot more time left than others, and some of them don't want to talk about it off the bat, so I start talking about that when it's comfortable. Usually my initial visit, I try to get to know them and find out some background about them, and then as I get to know them better, then we, start talking about disease progression.
When I think about the moments in our lives, and I think about music therapy in the hospice setting, I'm always amazed at how it's such a blessing and such a privilege to be able to come in and be with our patients and our families, and to be a witness to these amazing moments in their lives.
It's nice because a lot of people like to do life review, so they end up opening up a lot to me and telling a lot about their past and about their history.
I am a volunteer for Hudson Valley Hospice, and I work as a doula. Do my work as a doula. And we came to this calling using our experience in life and bringing it with us to help patients. Doulas started as birthing doulas, and it was brought into thinking that they would probably could use doulas for end-of-life doulas. So instead of comforting a mother who is giving birth, we're comforting a patient who is leaving the earth. And so that's one way of comforting.
When you come to the point where their comfort, where their dignity, where where your concern is for them as the human being you knew them to be takes hold, that's the moment when it makes sense to think about hospice.
Brings you up close and personal to yourself.
I can't say enough about Hudson Valley Hospice and the nurses and everybody involved with the organization, between helping my mother out when my father was sick, and then more recently when my mother was sick, helping myself and my brothers out with caring for my mother and making sure that she was able to stay home, which is where she wanted to be.
I'm probably a very small minority of people that get up every day and say, I want to go to the hospital. Nobody wants to be in the hospital. And once somebody comes into the hospital, the first thing they want to do is get out of the hospital. So we're here, we're treating the patient for a very short period of time. And as such, we have to provide the services that we provided on a more extended period years ago in a briefer period of time. So it's very important to have partners in the care process, and Hudson Valley Hospice provides that partnership for a total patient experience.
The patients we care for in the community need a collaborative process. And by that I mean we treat patients who are acutely ill. And there's a time in their life when they want to transition from that acute care to a different level of care, maybe an end-of-life care or comfort care. And the ability to bring in hospice of the Hudson Valley and to bring that level of care to the patients is critically important to us.
Arch Care at Ferncliff and Hudson Valley Hospice are working together collaboratively to design a hospice suite for the residents. The goal is to provide a more private and home-like setting for the residents and their families as the residents become more acute.
I think the relationship between Hudson Valley Hospice and the hospitals that serve this community is important. It allows us as healthcare providers to make sure that we have the right resources in place to be able to take care of patients where they live.
Hudson Valley Hospice has a really special place in my heart.